Welcome to the Wellness Protocol, your source for guidance on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on each episode, I'll share simple tools rooted in science and experience to help you feel better, live longer, and take control of your health. Welcome to the Wellness Protocol, your go-to podcast for clear answers on hormones, metabolism, and longevity. I'm Dr. Alessia Roehnelt, your endocrinologist and hormone health expert. Today, we're diving into one of the most frequently misunderstood topics, thyroid medications. If you've ever heard of the different formulations like Synthroid, levothyroxine, Armour, Thyroid, you've wondered what the differences are, why some patients are prescribed one versus the other. Well, then this episode is for you. Make sure to hit subscribe, leave a review, or share the episode with anyone who you think will benefit. Let's dive in. First, let's cover what the thyroid actually does. Your thyroid gland is located at the base of your neck, and it produces hormones called T3 and T4. T4 is the inactive form, and T3 is the active form. These hormones control your metabolism, your energy, mood, heart rate, the speed at which your bowels move, and even more. So when your thyroid isn't making enough of these hormones, it's called hypothyroidism. And you might feel tired, sluggish. Your metabolism is slower, so you might be gaining weight. You might even notice changes in your skin or hair, such as very dry skin or brittle hair or even hair loss. You might even experience mood swings like more depression. The goal of thyroid medications is to restore the normal healthy levels of these hormones in your body so that your metabolism is optimized and you're feeling your best. The human thyroid makes mostly T4. About 80% of what comes out of the thyroid is T4, but the body has enzymes to convert T4, the inactive form, into T3, the active form. The generic of this is called levothyroxine. It is T4 hormone, and it's pretty much identical to the T4 hormone that the human body makes. When you're on T4 hormone, your body is converting that medicine into T3 in order to make sure you are getting enough thyroid hormone and that your body feels the best that it can. You might be familiar with some of the brands of this kind of medication. Those would be Synthroid, Levoxyl, Thyroid, Euthyrox. There are a lot of different types of brands, but they are the same component, which is levothyroxine or T4 hormone. Each of these brands or generics are a little bit different. Now, while the main active ingredient is the same, it's all T4, the difference between these is really the different components and additives that the manufacturer might add. For instance, if you have a specific color for your thyroid medication, that dye is coming from a specific manufacturer. One of the most pure forms of T4 hormone is a brand called Thyroid. It contains the fewest ingredients, the fewest additives. It is certainly the most trusted to be gluten-free, and that can be very important for people who are sensitive to gluten or might even have celiac disease. Most patients tolerate these medications equally. Again, most patients. If you are extremely sensitive to medications, if you're very sensitive to different dyes or fillers, you might find you don't feel as well on one brand versus another, or on one brand versus even generic. But for most people, they do feel about the same on these medications. The most important part about these medications is making sure you're taking them the right way. Thyroid medication, like levothyroxine, is actually not absorbed in the stomach. It's absorbed a little bit downstream in the intestines. Therefore, the medication needs to be taken in a very specific way so that it bypasses some of the processes in the stomach to break things down, and it's allowed to pass on to the intestine where it can be fully absorbed. The medication needs to be taken first thing in the morning on an empty stomach with water, and you need to wait at least 30 minutes or more before you have anything else to eat or drink or any other medications. The idea here is that if you were to take your medicine and then eat breakfast shortly after. The food you're taking in is going to activate your stomach digestive enzymes. And while those digestive enzymes are working to break down your food, they're also breaking down your thyroid medication and not giving your body the ability to absorb it a little bit downstream. So it is important to make sure that this thyroid medication goes in and your stomach doesn't see anything else for at least 30 minutes. There are a few other problems with thyroid medication. You need to be careful not to take it too close to two very specific vitamins, calcium and iron. These vitamins are known to really disrupt the absorption of thyroid medication, so they should be taken at least 4 hours later. The really nice thing, though, to thyroid medication like levothyroxine is that if you miss a day by accident, you actually can just double up on your dose the next day. I oftentimes have patients ask me, what happens if I miss it? How do I try to take it at some point later in the day if I've already eaten something? And I always tell them, don't worry about that day, just skip it and take 2 the following morning, because it's more important to make sure this medicine gets absorbed appropriately in your body rather than trying to fit it in some other time during the day. The reason you can double up on a medication like this is because one pill lasts in your body and gives you a good amount of thyroid hormone for about 7 days. Because each pill lasts such a long time, and you're creating a steady state of medication in your system every day, it is reasonable to double up on this medication if a dose is missed. If you're on thyroid medication, you may even have been told by your doctor to double up some days or skip 1 day a week. And again, that is because this medicine lasts so long in your body, we're actually able to average the dose over the course of a week instead of a specific dose every day. So in that sense, levothyroxine is a very unique medication. Many patients will ask me if I feel they need to be on a brand like Synthroid versus the generic levothyroxine. My answer to that is that generally, most people really do okay on just the generic. So I oftentimes will advise my patients to at least try it, because this is usually medicine people need to take long term. And if you need to be filling this prescription every month from the pharmacy for the rest of your life, it's not a bad idea to use one that's a little bit more cost effective. However, if patients find that when they take their thyroid medicine, it's bothering their stomach, they're getting a little bit of indigestion, maybe they're having other symptoms like a rash, we know that this medication might not be the best for their body. We also want to make sure that the patient is absorbing the medication well. Some patients do absorb one better than the other. It's not necessarily that people absorb the brand better than the generic. Sometimes it is the reverse. So when we put patients on thyroid medications, we want to check blood work afterwards, about 6 to 8 weeks later, to make sure that they are fully absorbing the medication and that they're on the right dose. When you are on the right dose of medication, most patients feel great. Their symptoms are controlled, their blood work looks good and is very consistent, and they have no side effects or problems. However, not everybody fits into that category. Sometimes we will see that the blood work numbers look fantastic, but the patient is still having persistent symptoms of an underactive thyroid. They might still feel very tired. They might still feel very foggy. And these symptoms sometimes get better when you add the other thyroid hormone, T3. This is not the universal rule. And in fact, most patients, when you add T3, don't feel any improvement in their symptoms. But I will oftentimes offer it, at least to my patients, to see if they have a positive response, because we don't know who is going to respond well to T3 and who is not. T3 hormone is either referred to as Cytomel, which is the brand, or liothyronine, which is the generic. Unlike levothyroxine or T4, it doesn't rely on your body's enzymes to convert it into an active form. So this is sometimes a good option for people when we think they might be slow converters of T4 into T3. But here's the catch. The half-life of Cytomel is much shorter than levothyroxine. So I said before that levothyroxine, one pill lasts about 7 days in your body. With Cytomel, it's lasting a few hours, maybe 6 to 8 hours. You also can't double up on this medication if you miss a dose because it's not acting the same way that levothyroxine does. The nice thing, though, about giving Cytomel or liothyronine a try is that if it's going to work for you, it's going to work right away. Again, this is not a medicine that needs to be converted into an active form. This is not a medicine where we need to wait weeks to reach therapeutic levels. This is a medicine where if you're going to feel better, you're going to feel better right away. So I'll sometimes tell my patients, let's try this for a couple days and see how you feel for a few days. If you're not feeling better, just stop it. But some people will say they start T3 and they feel like this cloud has been lifted and they can finally think clearly. And it really can make such a huge difference for a small amount of patients. So to review, the typical treatment for hypothyroidism would involve starting with T4 hormone or levothyroxine or Synthroid, tweaking the dose so that your symptoms improve and your blood work improves, and possibly for a small percentage of people, adding T3 hormone to see if that also makes a positive difference. But there are other forms of thyroid medication. So let's talk about some of these natural thyroid hormones. The two major brands of natural thyroid hormones would be Armour thyroid or NP thyroid. These medications are derived from desiccated pig thyroid glands. Pig thyroid glands contain both hormones, T4 and T3. But here's the problem with pig thyroid hormone. Pig thyroids are very different than human thyroids. Human thyroids make about 10 to 12 times as much T4 as T3, but pig thyroids only make about 4 to 1. That means that when you take pig thyroid, your body is seeing a much higher amount of T3 than it's used to, and sometimes a much lower amount of T4 than it's used to. While some patients actually feel much better on this regimen, many patients do have side effects. If your body is seeing too much T3 hormone, it can lead to heart palpitations or arrhythmias when your heart starts to beat out of sync. It can cause or worsen osteoporosis. It can make people feel very jittery. And it's also not the recommended treatment in pregnancy. The other caveat to taking desiccated pig hormone is that each time you go to the pharmacy to get a new bottle, you are getting a new batch of pig thyroid glands. And some pigs actually have hypothyroidism and some pigs have hyperthyroidism. And there is generally a little bit of a variation month to month in the amount of hormones that you're getting. So it's not as consistent as when you take the synthetic form of thyroid hormone. So if you're very sensitive to little changes in medications, you might really feel that when you're on something like Armour or NP thyroid. These treatment options are not right for everyone, and I would argue they're probably not right for most patients, but there are individuals where pig thyroid actually really helps patients' symptoms and makes them feel optimal. So it's certainly a discussion to have with your doctor. Any type of thyroid medicine does need close monitoring. You need to monitor symptoms, you need to monitor vital signs like heart rate, and you absolutely need to monitor lab tests. So it's important that if you're on thyroid medication, you are working with your doctor and making sure you're monitored as often or as infrequently as you need. So how do you know which is the right medication for you? There's no absolute answer on this, but I'll tell you how I approach it as an endocrinologist. I generally start with generic levothyroxine because most patients do absolutely perfect on this regimen. They don't need to add any more medications. They feel great and they're getting a consistent amount of medication each month, and it's also cost effective. If a patient is having side effects to a particular medicine, if we feel that they're not absorbing it well, if we feel that they might be sensitive to things like possible gluten contamination and they need a strictly gluten-free version, we might change them to one of the brands like Synthroid or Thyrosin. If a patient's blood work is improving but their symptoms are not, that's when I will sometimes advise adding T3 hormone like Cytomel or liothyronine. And if despite all of this, we still feel like symptoms are present or blood work is not optimized, that's when we might have a discussion about switching to one of the desiccated pig thyroid medications. But the best medicine is really the one personalized to your symptoms, to your lifestyle, to your blood work, to your sensitivities. And so that's why having a trusted endocrinologist on your side is critical to fine-tuning your dosage. Let's talk about some of the common pitfalls and troubleshooting tips when it comes to thyroid medicine. So number one, not being consistent. You always have to take your medicine the same way, empty stomach, with water, wait at least 30 minutes before you have anything else to eat or drink. Because if you're not absorbing that medicine, it's like you didn't take it at all. And making sure that you're getting in every dose that week is so important. This is not a medication that you can miss even if you're feeling fine. It's a maintenance medicine that you need to take every day. And luckily, if you miss by accident, if you're on something like T4, you can easily double up your dose to get in the full dose for that week. Another common pitfall is when people start taking supplements incorrectly. You have to make sure that if you're on anything that contains iron or calcium, which is very common in a multivitamin, that you are taking those vitamins at least 4 hours after your levothyroxine. And make sure to communicate everything with your doctor. I have had patients sometimes who will self-adjust their own doses. That is not a safe thing to do because, again, thyroid hormone affects a lot of hormones. It affects your heart, it affects your brain, it affects your GI system. You don't want to be on too much or too little because it can cause health issues. So make sure to touch base with your doctor if you're not feeling well and think you might need an adjustment. That being said, a lot of conditions have the same symptoms as hypothyroidism. So even though you might feel that your symptoms are due to thyroid, if after a full evaluation with your doctor, it turns out that maybe something else is going on, it's important to keep an open mind and explore other possibilities for why some of these symptoms are persisting. Now I just want to cover some frequently asked questions from a lot of my patients. Number one, I'm always asked which form of T4 is gluten-free. Now, I can say for sure that the brand Thyroid is gluten-free. However, the other brands don't necessarily contain gluten. It's just a concern of having gluten contamination during processing. This will depend on each manufacturer. So sometimes there are certain manufacturers that make the generic levothyroxine, and they actually can guarantee it to be gluten-free. One way to find this out is to call the pharmacy and find out who the manufacturer is of your thyroid medication, and then call that company and see if their version of levothyroxine or T4 is gluten-free, because you don't necessarily have to pay these very high amounts for certain brands when your pharmacy might carry a generic that actually is gluten-free. Another frequently asked question is, what if my manufacturer changes? I will have patients call me or send a message saying, my pill used to be a circle and now it's an oblong shape, or it used to be a circle and now it's a square, or the color has changed. That generally means that the manufacturer of your thyroid medication has changed, that the pharmacy is paired with someone else. Usually it's fine, but if when you switch, you are having any side effects, like it's bothering your stomach, it's making you feel nauseous, or perhaps on your follow-up blood work, the level is a little bit off, it may have to do with the change in manufacturer, so just communicate that with your doctor. And number three, do the desiccated pig thyroid hormones have side effects? I would say the side effects generally are rare, but that high amount of T3 can make people feel jittery, on edge, and increase anxiety levels. Normally, this can be solved by just titrating down the dose, but it's certainly something to be on the lookout for if you're on one of these forms of thyroid hormone. So there you have it, thyroid medications 101. We covered levothyroxine, we covered Synthroid, we covered Armour and NP thyroid. And what's the key takeaway? It's that everybody is different, so you have to work closely with your endocrinologist to find out what is the best match for your body and what's going to make you feel the best. For most people, it really is going to be good old-fashioned generic T4 hormone, but that is not the solution for everyone. So explore that with your physician. If you enjoyed this episode, please subscribe, leave a review, share it with friends or family who might benefit from it, and follow me on Instagram at EndoHealthDoc for daily tips. Until next time, this is Dr. Alessia Roehnelt reminding you that knowledge empowers your health. See you next week on the Wellness Protocol.